Hi, I'm Dr. Bhargav Rao from Pathofast Lab, Pune, and today I'm going to tell you everything you need to know about the alkaline phosphatase blood test. If you have symptoms like itching of the skin, you're feeling very tired, you feel nauseated, exhausted, or your skin has turned a little yellowish, which has a yellowish tinge, your doctor may have advised an alkaline phosphatase blood test. And today I'm going to tell you everything about this simple blood test. So what is the alkaline phosphatase test? The alkaline phosphatase test is a blood test in which we measure the level of an enzyme called alkaline phosphatase in your blood. This is an enzyme that is involved in breaking down of proteins. There are 4 types of alkaline phosphatase, but we are interested in the one that primarily deals with the liver. It is also present in the bone and some of the other tissues in our body. What are some symptoms that you might be having which mean that you should get an alkaline phosphatase test? So the first and the most common one is itching. You might have itching all over your body, especially on your arms and your feet. You might be feeling very tired. Tiredness or fatigue is very common. The third is stomach pain, especially on the right side of the stomach. The fourth is jaundice, in which your skin, urine and eyes turn a dark yellow in color. Fifth could be pale stools. Your stools are no longer brown, but they become almost clay white in color. You might be having pain on your shoulder, which could be indicating something wrong with your gallbladder. You might be also having bone pain on the lower back or somewhere else in your body, pain on the bones, and of course dark urine. All these are symptoms of either something wrong with your bones or with your liver or your gallbladder, and all of them will raise your alkaline phosphatase level, and so you must get the test done. So when will a doctor advise an alkaline phosphatase test? Which diseases do they think that you might be having because of which they said you should get this test done? So the first thing that it does is it checks for liver damage. Any kind of liver damage will usually give us some elevation of alkaline phosphatase. Second is problems with the bile duct. The gallbladder is connected to your stomach through something called the bile duct. If that is obstructed or there is something wrong with your gallbladder itself, it will cause your alkaline phosphatase level to rise. Third is that any cancer which has spread into your liver from somewhere else could cause the alkaline phosphatase level to rise. Fourth, stones in your gallbladder, which are called gallstones, could also cause this. In men who are suspected of having prostate cancer, the alkaline phosphatase test is always done to check whether the cancer has spread to the bones. The next one is when there are weak bones in people who we suspect of having very weak bones because of low vitamin D or low calcium. This condition is called osteomalacia. Also, patients who have problems with their parathyroid glands, because that disturbs the bone metabolism and causes changes in your entire levels of your alkaline phosphatase. So all these things, as well as any medicine that may have damaged your liver, if your doctor is suspecting any of these things, they'll ask you to get an alkaline phosphatase test done. So how is the alkaline phosphatase test done? Well, this is a simple blood test. They will insert a needle into the vein in your arm, draw a few ml of blood and process it in the lab. It is usually processed in the Department of Biochemistry. The units of the result are called international units per liter, and this is one of those tests in which you don't really need to prepare in any special way beforehand. Fasting is generally not recommended, and usually you will get the reports on the same day. What are the normal ranges of the alkaline phosphatase blood test? I've included an entire detailed list of normal ranges in this slide. You can see that the normal ranges are generally a little higher in children, but they go on reducing as they get older. The normal range is also slightly higher in men than it's in women. You can take a screenshot of this slide if you want to save it. I've also included it in the description. Together with your alkaline phosphatase test, your doctor may also recommend that you get something called the R value done, and it's really important because the alkaline phosphatase test result is used to calculate this R value. So this R value, put simply, is basically a ratio or a proportion of the level of your liver transaminases, which are the SGOT and the SGPT, as compared to the level of your alkaline phosphatase. Now, why does this matter? Usually, if there is something wrong primarily with your liver, your transaminases, which are the SGOT and the SGPT, will rise a lot, but the alkaline phosphatase won't rise that much. On the other hand, if there's something wrong with your gallbladder or your bile duct, your transaminases won't rise much, but your alkaline phosphatase will rise a lot. So you can see that, as I've included in the slide here, if there are problems in the liver, we have a high SGPT level and a low alkaline phosphatase level. There are some causes of liver damage that I've included, like for example viral infections or cancers, too much alcohol, fatty liver. These are all things in which the liver will be damaged more, and your SGPT level will rise a lot. Alkaline phosphatase won't rise as much. On the other hand, if there's something with your gallbladder, it will be the opposite. There'll be a lower, the SGPT level will rise but not as much, and the alkaline phosphatase will rise much more. So this R value allows doctors to tell whether there's something wrong with your liver or it's something wrong with your gallbladder, or in some situations it could be both.